Hello, everyone. So I know by now people know what's going on. And I talked about this weeks ago. And so I want you to see in the orange, if you can see what I'm saying, 1 million Californians filed for unemployment since March 13th. Okay, let me get you up to speed with what I've experienced here in Los Angeles. So, first off, no toilet paper. You got to stand 6 feet away from people if you go to grocery stores. There's some grocery stores doing that, some practicing the social distancing, and some of us know what that is, where you have to stand 6 feet away from another person or try to stand at least a distance from another person that you're not right up on them, so that in hopes that you'll be a little bit safer because of this COVID-19. So much panic buying, so much fear, so much is being said. And there were some businesses that were operating, even here in Los Angeles. And Eric Garcetti, early this morning, stated specifically that if there were businesses that were operating and not following the rules of the law, that their water and their power would be shut off, because this is how serious this pandemic of COVID-19 is. They've had more deaths. They've had more cases. Within, I believe, a 48-hour span, 138 or 139 cases here in California of people with COVID-19. And so it's pretty serious. And so they recently passed a deal of a stimulus package, but the growing debate is whether they should open things back up April 12th, is what is projected by Donald Trump. And so it's not sure whether that's the smartest idea, because this disease is still rampant all over California, and a lot of people are dying. And a lot of people, if they're not dying, they're getting sick. So you can see all the people affected. After being courted by Trump, African Americans, Latinos face economic blow from the coronavirus. Now, just putting that in perspective, there has been a lot of talk about, even before this virus hit, about the wage gap and about, economic inequality. And a lot of that had been talked about. A lot of it had been protested. A lot of it had been brought up in the presidential election. This is still an election year. And so a lot of people who noticed that this was getting a lot more serious than to be expected, that a lot of these jobs, like hospitality jobs, jobs that are in restaurants, jobs that are lower wage jobs, seem to be, there's a lot of people that have been laid off. So that is the reason why unemployment has skyrocketed. And fortunately, for some people, they're able to work at home, but that's unfortunate for a large number of people who don't have jobs where they can just work at home behind a computer or a tablet or what have you, or a telephone. And so, so this is in politics, and this is the economic blow. And there's lots of economic blow, even in the Wall Street. The numbers are up and down in Wall Street. It's really bad. So after being courted by Trump, African Americans and Latinos face economic blow from the coronavirus. So after being courted by Trump, that's what the article says, the hardest hit in terms of the minority group, not saying that others aren't hit hard, but usually tends to be African American and Latinos facing economic blows. And I would assume these are people that are in the lower income earning category. So this is by a Jason Lange, Washington, out of Reuters. Financial hardship caused by the coronavirus outbreak could fall particularly hard on African Americans and Latinos, undoing economic gains. So President Donald Trump has touted in his outreach to these key voting blocs ahead of the November 3rd election. So with job cuts that are hitting the U.S. states as governors and the companies order offices and workplaces to close, African American and Latino population are particularly vulnerable because they more often have the jobs that cannot be done at home, which is true. And so that will make them more severely impacted by the extended coronavirus shutdown of the economy. And the shutdown that's happening, it's a lockdown where a lot of the jobs have laid off workers, have told people they have to go home. A lot of these places, it's not guaranteed that you can come back to these jobs. There's no paid sick leave. And so it has impacted a lot of people greatly. So that will make them in this group more impacted by the extended shutdown. And so this was said by a Jay Shambaugh. And so correct me if I'm wrong about the name. So the White House economist during the Democratic President Barack Obama's administration. So Labor Department data shows that 19.7% of African American and 16.2% of Hispanics said that they could work at home. But this was in 2017, and that was all the way from 2017 to 2018, compared with 29% or 29.9% of whites. Okay, so that's basically telling you that just looking at that right there, just a small tidbit of income inequality in some sense, that you have one group of people or two groups of people that seem to be a lot marginalized versus another. And so the department's most recent data on unemployment benefits show the nationwide surge in new filings. And so that's probably within this month, with many states reporting layoffs in service industries such as hotels, restaurants, according to the Department of March 19 report. And so those are industries where African American and Latino make up outsized shares of employment, including hotels, where the two groups make up nearly half of the employees. So while African Americans and Hispanics overwhelmingly disapprove of Trump over his immigration policies and handling of race relations, the Trump campaign has increased its outreach to those particular two groups in hopes of picking off enough votes to win potentially razor-thin contest in electoral swing states. So African Americans and Hispanics will comprise about a quarter of eligible voters in November, slightly more than in 2016 election, according to the Pew Research Center. So their votes could be the key in the battleground states like Michigan, Pennsylvania, Florida, to help propel the Republican Trump to victory in 2016. But the health crises, which has now culminated now with this crisis we're going through with the COVID-19, of course, I believe that's what they're getting into. In a full-blown economic crisis has cost the campaign its number one talking point. So that a soaring economy and a record low unemployment rates of African Americans and Hispanics are the reasons to vote for him. Well, we see that's not the case right now. So Ayanna James, a 27-year-old black woman in College Park, Georgia, was laid off this week from her job at a gardening store after business slowed down because of the outbreak. And so she considers herself a moderate Democrat while disapproving of Trump's immigration policies before the health crisis. She thought he was doing a good job on the economy, but she believes that he has not done enough to deal with the global pandemic that has upended American life. upended American life. So he should have responded more quickly, and that's what a lot of people I'm hearing. This is the talk, not just from this article, but I'm hearing a lot of people say he should have responded a lot more quicker than he did on this issue of this pandemic. It took him a long time to say it was a pandemic. They hid that information. You know, the numbers, a lot of people are not trusting of the numbers of people that are dying. And what I'm just going to throw out there some things that I read, because there's a calamity of articles that I've read, that there's a wealthy group of Asian students that they're trying to leave Hubei province, and this is in China. I think it's somewhere near China or in China, and they're trying to get out because the lockdown has been slightly lifted. And so they're paying large sums of money to get out. That throws up a red flag for me. Like, if everything is okay now in China, because we've been hearing mixed messages that everything is slowing down. The people that died, a lot of people had died. They gave their numbers. What I've known about that particular government is they keep a lot of things secret. And so if everything is slowed down and there's not that many people dying over there in China, why are a group of people trying to move from Hubei now that the lockdowns have been lifted? It's almost like something's still happening and they're afraid and they're trying to get away from it. It's very scary. That's a mixed message that is sending. And the other thing is I'm hearing that because this virus is now being said by the WHO, which is the World Health Organization, that U.S. may be the epicenter for a large number of deaths, that some people are trying to get out of the U.S. because they're in fear of what's to come. And April the 12th is when Donald Trump is talking about opening things up. Now, he had a doctor or a guy that was talking about the projected weeks that we should stay in our homes and shelter in place. But lately, he has not been talking. They've kind of removed him. And it almost feels as though they're doing the same thing that happened with that doctor that was in China, where they silenced him. In December, they didn't want him to come out and admit how contagious this disease of COVID-19 really was back then. And so what I was hearing is that it was as far back as November 2019 when they had the first case of this. And so they went ahead and tried to silence him because that government tries to keep all of their problems within their country and within their own circle. But it has cost a lot of lives, even the lives of that country there. And so now what I'm seeing, or hearing rather, is that there are people trying to get out because they're sort of the virus has kind of taken its course there. But what is it that they're spending $20,000 for plane tickets to get out of Hubei province to come somewhere else or go somewhere else and flee because now the lockdowns are being lifted? What was going on there that they fear that they got to get out of there right away? That's the part we're not hearing about. I just wanted to put that in here. So as this article goes, it says, Trump's approval rating has edged higher in the past week among all Americans, including African Americans and Hispanics, suggested it is possible that he will earn some credit for his handling of this crisis. But still only a few African Americans and about 1 in 3 Latinos approve the job that he is doing as president, roughly the same level as when he took office. Okay? And so the question is he the right leader for this crisis? Trump is going to make a different argument to those groups that he had planned to make before the coronavirus, said Alex Continent, a White House spokesman during the Republican President George W. Bush administration. So instead of pointing to the record unemployment, he'll have to point to his handling of the coronavirus and what he's doing specifically to help those groups recover. And so after initially downplaying this outbreak, and that was one argument that a lot of people were seeing that they weren't happy with, is that Trump, he made it seem as though it wasn't as serious and he should have acted quicker. And these are the complaints that I've heard even here in Los Angeles of California. Trump has taken more forceful action in recent days because of the numbers of people that are dying. Now, I'm going to add some things in here that I've really observed, is that most of the people I noticed seem like people who, I'm assuming they're a lot older, they're retired, they have saved money, and then those that haven't saved money, they are just wealthier people, seem to be the ones that were hit more in the beginning. It sounded like they were on cruise ships, people that were traveling back and forth, people that are entertainers that have to travel to different countries, had a higher risk of exposure, or higher chance of exposure rather. The people they say that's higher risk are people that have some previous health complications, like maybe if they have pre-existing not injuries, but pre-existing health problems. If it's diabetes, if it's heart problems, and then age plays a factor in it. I've heard that through some of the literature on COVID-19, and then also people who are in areas where it is like hardest hit or is more readily easy to contract, because the spread is really, really large there, like Wuhan, Italy, and now there's a bunch of other places that have been listed as showing signs of spreading. And so that's why here, even in California, now we're seeing the numbers starting to grow and the death toll is starting to also rise. And so that is the thing that is very scary. A lot of people, what I've seen in my personal experience, is a lot of the stores look like somebody just took their arms and just grabbed everything and threw it all in the basket, if you can visualize that. Most of the paper towels, all of the tissue is gone. You have to go early in the morning if you're a senior citizen to do your shopping between, I believe it's the hours of 7 to maybe 8. Some are open as earlier than that, and a lot of the stores close around 8 here in Los Angeles. A lot of them don't stay open that late. And I guess that's to curb some of the panic buying and the lines and the monotony, and then also to be able to restock items back on the shelves, because they're not able to put things on the shelf as fast as it's being taken down because of the panic. There's a lot of gun buying. People that are afraid they're going to get looted, or it's going to get even more chaotic in the coming weeks because of the deaths and because of the fear and people running around trying to grab items. And then when people are without items, or they have one person they assume has more than they do, they're afraid there might be looting, there might be mayhem. What I have seen that I know is irregular, I've seen a lot of more ambulance going in and out of the streets. And so I'm assuming they were going to a lot of the nursing homes where people probably are more vulnerable because of age and health issues. So that's what I've seen. I don't know what they're saying in the news except what I've seen about the stimulus package and how they're going to try to give a kick to unemployment, people who have filed unemployment. And I did see another article that also said that people might not even see their money until May. A lot of the evictions have been halted. There's a freeze on the rents, because a lot of people are not able to pay because they're not able to go to work because the workplaces are closed down. By law, a lot of these places are closed down. They had, I believe it was in Hollywood, there was a hiking trail. They closed that down early, I think yesterday, maybe this week or this morning. It was on the news that there was a lot of people that were clan gated, or rather gathered together too closely and not taking this virus of COVID-19 serious enough. And they were in fear that it could create more problems the more people are out and the more people are closer together, it'll be just like the situation with Italy where people are not taking it serious, and then more people will contract COVID-19, and then it'll possibly lead more deaths. So that will follow. And so there's been a lot of donations. I believe, if I'm not serves me correct, I read that Elon Musk, he donated 1,000 ventilators to Los Angeles recently. He is the one that has to do with the Tesla car and his business. And so I've been pretty busy reading a lot of different things. So I didn't want to pull up all these different articles. So I just was throwing out there some of the things I know in my head, and some things that probably people have seen or heard of as well that you might be familiar with. So going back to this article, it has been very scary, but I digress. So it says that the president is uniting Americans through his leadership, and voters are responding. Blacks, Latinos included, campaign spokesman Tim Murtaugh said in an email. So Juliet Valentino, 29 years of age, a Hispanic woman in San Antonio who was once a Democrat but now considers herself a moderate Republican, does not blame Trump for the crises, even though she and her husband were laid off from a pet care center because of this outbreak. And so, saying she would probably vote for Trump in November, Valentino said that his administration has seemed to get a handle on this. So some people are back and forth on the issue with Trump. Some people feel like he should have handled it a lot sooner. There's this pendulum that swings back and forth of debate on these issues. Now, what I do know is that a lot of people were looking for the stimulus package that they finally made a deal on. I believe, as I recall reading, it was $2 trillion. And it included some companies, the airlines, the cruise companies that deal with the ships, and a number of other things that I am full aware. And I'm sure that maybe some people might have run across these articles themselves. But so on that note, it says the massive U.S. economic rescue plan is only the start. And so I'm not going to go into any other articles, but what I'm saying is that it's been really crazy. What I've known I've never seen such panic buying. You know, there have been people that have been in stores where they have these long lines formed, and you know, now it's at the point where you just got to get your essentials. You got to go to the pharmacy, pick up your medicines. If you try to get some toiletries, if there's any left over, some things. A lot of people have resorted to trying to order things online and have things sent to them. But even now, there's a fear of that, because recently I ran across an article saying that some of the Amazon workers have come down with COVID-19. And so people are afraid to order packages because they don't know if that disease is going to be on their packages. And so I'm just telling you some of the things that maybe these are details that they have not really spoke upon on some of these news stations. But they have said that there's these mobiles, drive-up mobiles, where you can get free testing to find out if you have in fact been exposed or you have contracted COVID-19. They have a website. The WHO has a website. World Health Organization has a website, so you can see what the symptoms are. Some of the newer symptoms is what I've been hearing is a loss of smell, a loss of taste, diarrhea, and nausea, and possible vomiting is another one. The mild cases are not mild like, oh, I got the sniffles. You still could be laying on your back, even with the mild case of this disease. It's a virus. There's no cure. They have, as of yet, not really found a vaccine, or they're working on it, but I haven't heard of, or from what I've heard, they haven't said that they've got a vaccine yet. enough, at least enough for a lot of people that are coming down with this. So I believe that's the reason why they're trying to work on the social distancing and people staying home and shelter in place and trying to do a thing where they're slowing the spread so it gives them time, because they're scrambling to try to get enough resources to get a vaccine out for people. The growing fear is that they don't have enough beds, and that is the issue. The more people contract this, the more need for some of those resources like the ventilators and stuff. And some of the rich could be doing their part, and there has been some people that are doing their part, but there's been a number of folks who haven't been donating, have been offering help. There has been some wealthy donors that have been donating to shelters and to food banks and to hospitals, but from what I've read, not enough. And so this is the fear that there is also not only hoarding of tissue paper and toilet paper, what have you, and paper towels and little food, but there are also people who have lots of money who are hoarding their money, and they're not saying anything, they're staying silent. So having said this, I'm going to let this video go. What do you think about this? This is really sad that we're living in times like this, but yeah, it's gotten really bad. But I'm gonna let this video go. Like, comment, subscribe, and then give your feedback. What have you experienced in your neighborhood, in your town? What I know, in the beginning, people were saying, because this is an election year, these are the things that I've heard, just at random. It's a hoax. It's not true. Now that there's more people dying and more people coming down with it and more people reacting to this and more businesses being shut down and more press coverage on the issues and more symptoms that are said to be coming out from who might have possibly contracted it, I'm not hearing as much of that anymore. I'm seeing a lot of fear and people going to the stores and making mad dashes to try to get as much resources as much as they can. There are some people that get to the store, they break down because they can't find some of the things that they need for their household, because a lot of the shelves are bare. And so you have some people posting videos that they can't get diapers, they can't get tissue. Even saw an article where some people were dialing 911 because they didn't have tissue or they ran out. Also an article about the sewage being backed up because people were, if they didn't have any tissue, they were using paper towels, which are thicker, and I guess it stops up the pipes and it causes more sewage buildup. So there's a lot of things going on, you guys. Stay safe out there. What are your thoughts and feedback? It's really scary times we're living in. I did hear that the National Guard was deployed in some various areas. They're supposed to be handing out food bags. All of the LAUSD is supposed to be doing lunches throughout the coming weeks. We don't know where this is going to lead, but the fear is growing. The fear is growing. Thanks for listening.